Nerve root stimulation, as we already have seen in many presentations, is not a new technique. It has been around for several years, even before the advent of the concept of DRG stimulation. Many studies have described different approaches detailing their efficacy, safety, and limitations. Like DRG stimulation, nerve root stimulation offers a notable advantage in cases where the pain has a dermatomal distribution or is localized to specific areas not well covered by spinal cord stimulation. Different electrode placement strategies have been developed to accomplish nerve root stimulation, and I'd like to review showing briefly the techniques described so far. Well, the intraspinal method, the electrodes are placed epidurally, similar to a conventional SCS, but in the lateral aspect of the epidural canal.